Hi, I'm Callie Anders with GVTV, and in light of the holiday season, we thought it would be a great idea to talk about dental hygiene because of all of the junk food we're about to eat. So, today with me is Danielle Harding. She's a dental student from DMACC, and we're going to talk a little bit about how to keep our teeth and mouth healthy, right?
Yes.
Okay, so first off, just how important is it to keep our mouth in good shape?
Obviously, everyone knows you should brush your teeth at least a couple times a day. But the reason it's really important is because your oral health, everything going on with your teeth and gums is really going to have an effect on the rest of your body. Brushing 2 times a day would be the minimum, I would say, for anyone to do. But, brushing anywhere in between 2 and 4 times is really going to keep that in good shape for you. It's going to keep your teeth looking good and, keep you feeling good.
Sure. Now, what kind of over-the-counter products do you recommend? Some good, toothpaste, toothbrushes, those kind of things.
When you're looking for a toothbrush, most of your dentists, when they hand you a toothbrush when you leave your visit, it's going to be a soft bristle brush, and that's what everyone should really buy. I know they have the medium bristle and then a hard softness, but you really don't want to go for something like that. Your teeth are sensitive, and your gum area is what you're also going to be brushing, so you need to keep that in mind, and you're going to want to go for a softer feeling bristle. So that's one thing you need to keep in mind, but also, they have a lot of products out there that are really going to help anyone with any kind of situation they have going on. If you don't like to floss so much, they have a product for that. If you like to get a good rinse in at night, then they're going to have a lot of products like that.
Kind of, there's something for everyone. You just kind of have to find out what that is.
Exactly.
So what about teeth whitening? Are there, what's the kind of safety with that? And
with teeth whitening, a lot of times the best way to go is going to be go through your dentist. A lot of times they'll make you a custom probably going to get you the quickest results. But over-the-counter products such as Crest White strips, anything that you can put on, are going to work pretty well. I would say the strips work better than painting on. I know they have that kind of stuff. That tends to wash away with saliva. They're fairly good, but with any product like that that's going to have a fluoride or a bleaching agent in it, you may get some sensitivity. So you want to talk to your dentist about that and see what they recommend.
So that would kind of differ from person to person then?
Exactly, depending on your enamel. Some people have a little bit more sensitive teeth, and so there are products for those people, but you just want to kind of check it out, maybe even talk to your dentist, see what they recommend.
Okay. Now, whitening included, we kind of live in a society that encourages us to kind of fit a mold or be a certain way and be beautiful and look good all the time. So what kind of dental procedures exist now to kind of compensate for the dental flaws that people may have?
Well, for that, obviously you have braces and stuff like that, but now they've even got braces that you can wear on the inside of your teeth. So they're less visible. You're going to still get that straightening that you need over time, but it's going to be on the inside, so it's less apparent to people. Another option that you have...
but is that like a retainer kind of thing?
It's going to be exactly like braces, but it's just going to be on the very inside of your
teeth.
Oh,
I see. Okay.
They can do that. Another thing that they can do is you can do a retainer or something like that. That's going to be a slower movement, and a lot of times you wear those at night at home, so that's less visible to people. And for those that are really conscious about how their teeth look, another option, if you just have minor corrections that need to be done, possibly you can do veneers, which are going to be like putting a piece of enamel or enamel-like substance over your teeth that gives the illusion of whiter and or straighter looking teeth.
Now, can you do that for a full set of teeth?
You actually can do it for a full set, but a lot of times they'll just do it on the first 6 to first 8 teeth on the top and the bottom, just because exactly when you smile, that's what you're going to see from corner to corner.
So what are some of the best methods, I guess, to kind of keep your teeth, even if they are a little crooked, to keep them, plaque-free, cavity-free? What are some of the best things to use or do?
Definitely flossing is going to be right up there. A lot of people brush, but they fail to get that flossing in. They'll do it every now and then if they've got something in their teeth. You get, popcorn in your teeth, something like that.
I hate that.
Exactly. It's painful, but flossing is going to keep things really plaque-free. That's the way to get into all those areas, because if you look at it, your brush is not going to be able to get into all the little areas in between your teeth.
Creases.
And that's exactly where floss comes in. You really want to take advantage of that and what it can do for your oral health.
Now, what about mouthwash?
Mouthwash is another way to, go ahead and keep the oral cavity cleansed. You want to do that at night especially, because you're going to be laying there in between, 7-9 hours of sleep, and you're not doing anything. Your mouth is just building up bacteria. So you really want to go ahead and give it a good rinse at night, and that'll actually kind of help slow down bacteria growth and anything, inhibit them a little bit.
So now, is that something you just use at night, or is that, can you use that?
No, but especially then. You can use that anytime during the day. just make sure that's something that's going to work for you. If you're ever unsure about a product or something that you're doing with your routine for your teeth, just talk to your dentist. A lot of times they can get it figured out, and even if it's a simple question, don't feel like don't feel like you can't ask them, because that's what they're there for.
So I know a lot of those products, especially mouthwashes, Listerine and whatnot, I know that they target certain bacterias or diseases or whatever. So what are some of the common bacterias or things in your mouth that go on?
Yeah, one of the things you're going to see a lot of time on packaging is they aim towards gingivitis. And gingivitis, basically what it is, it's a small infection of your gums where you get the puffiness, the redness, some sensitivity, and maybe even some bleeding if you're brushing too hard, chew something crunchy, anything like that. That's very, very common, and that just comes from, you need to increase your brushing and flossing and things like that. But sometimes there are cases when you really can't prevent it so much. Another case that's really rampant among college students, people our age, is called trench mouth. It's referred to as trench mouth, which is also called ANUG, and that's acute necrotizing ulcerative gingivitis.
Sounds complicated.
Not really. It's just a little bit more extreme version of the gingivitis, and that's going to make your gums really inflamed, painful. You might even get some pus in there. But the reason that's caused, you could have okay oral hygiene and all that, but it's induced by stress also.
Oh,
that's why
perfect
I said
sense for college students to have that.
Anyone that's a student, you have high stress levels. That does tend to occur. That's something that good oral hygiene, again, like I said, you can't stress that enough. It's just really simple, really basic, and that's going to prevent a lot of things.
So now what's the care for that? I mean, how do you treat that?
A lot of times you're going to want to go see a doctor about that, because they'll probably get you on some antibiotics, which will control some of the swelling and any kind of infection that you have in there. But they're going to get you brushing and flossing again until you really need to get that rinsed out. They'll probably give you a rinse, something like that. It just kind of depends on the severity of the case.
Okay, I'm going to stop you there. We are going to take a quick break. When we come back, we are going to learn how to floss and brush correctly, and we're also going to give you some great stocking stuffer ideas to keep your friends and your family's teeth healthy for the holidays, so stay tuned.